Hey everybody, it's Mark, and today we're going to be talking a little bit about some patient education for a rotator cuff injury. Well, what is the rotator cuff? So the rotator cuff is comprised of four muscles in our shoulder that basically kind of help us swing our shoulder around. Today we're going to talk about what potential issues we could have and how we may treat them. Kind of going to start a little bit of least severe to most severe. On the lesser severe side, let's talk about a rotator cuff tendinopathy, irritation, inflammation of the rotator cuff tendons. Now, we're not talking about any rotator cuff tears yet. Rotator cuff tendinopathy, painful range of motion, limited range of motion, all sorts of symptoms that can make daily life pretty darn difficult. As far as treatment options for rotator cuff tendinopathy themselves, we do have quite a few. We could always talk very conservative managements with over-the-counter anti-inflammatories, prescription anti-inflammatories, maybe some prescription muscle relaxers as well. Physical therapy is also a great option for our rotator cuff tendinopathies. Working on range of motion, strength, function, stabilization, and support of our rotator cuff muscles is always going to be a good idea. Kind of ramping up our treatment a little bit. There are some great injection options for rotator cuff tendinopathy as well. We may consider something like a steroid injection to help with some of the swelling, irritation, inflammation, pain. May consider something like a PRP injection or platelet-rich plasma injection to, again, kind of help work to repair, help heal these rotator cuff tendon issues that we have. As far as rotator cuff tendinopathy, that's really the mainstay of treatment. We don't have to get too super aggressive, but let's kind of talk about the next step up in a rotator cuff injury, a partial thickness rotator cuff tear. At this point, we're kind of talking about some tendinous or muscular damage. The tendon's not just kind of irritated and inflamed, it's actually kind of torn a little bit. Now, the good news is we don't have a full thickness rotator cuff tear. Partial thickness rotator cuff tears can be very painful, and some do require surgery. On the very conservative side of things, some partial thickness rotator cuff tears can be treated with physical therapy, prescription medications, and injections. I usually recommend trying some conservative modalities first before we kind of ramp up and talk to an orthopedic surgeon about a rotator cuff repair. For some partial thickness rotator cuff injuries, or if we have severe partial thickness rotator cuff injuries, meaning it's not a full thickness tear, but we're about 75% of the way there, those are usually surgical in nature. This is one of those gray areas where we can definitely try some conservative things, but sometimes we end up having to have a surgery to fix it. Best thing to do in these cases is talk to your provider about how severe your rotator cuff injury is and kind of go from there. It may be worthwhile to bring up some of the conservative managements to see if those may be feasible for you. Ramping it up again, let's talk about worst rotator cuff injury. We have a full thickness rotator cuff tear. Full thickness rotator cuff tear is that tendon, it's not just inflamed, it's not just torn a little bit, that sucker's torn all the way. When we have a full thickness rotator cuff tear, that's an absolute surgical indication. Of course, we have our outliers. If we have some severe health issues and may not do well with an operation, we don't do one. But if you're a fairly young, healthy, active individual and you have full thickness rotator cuff tear, usually it's required a surgical fix to get that shoulder up and moving again. The reason why, that muscle doesn't have anything to pull on. I want you to kind of picture stretching a rubber band and cutting it in the middle. That sucker's gonna fly apart. Same thing can happen with that rotator cuff muscle. You get something called retraction. There's nothing holding that muscle together, and those two pieces can kind of retract on us, and that causes some further issues down the line. So, bottom line being, if you have a full thickness rotator cuff tear, would definitely recommend sitting down with a surgeon and discussing surgical treatment options. We've talked a lot today about all of our different types of rotator cuff injuries and a lot of modalities to treat them. I hope you got a little bit of information out of this. Again, it's always best to kind of work with your provider to talk about your specific injury, how severe it is, and what treatments are best for you. All right, everybody, thanks for tuning in. Appreciate your time.